President Duterte is now willing to be vaccinated against COVID-19 in public, weeks after Malacanang said the chief executive wanted to be inoculated behind closed doors. His close ally, Senator Christopher Bongo, asserts the move aims to boost confidence in the country's vaccine drive. He adds the president is just waiting to get medical clearance from his doctors. The president's spokesperson said last month Mr. Duterte wanted his privacy because the vaccine will be injected in his buttocks. His allies compared his decision back then to that of England's Queen Elizabeth, who opted not to get vaccinated in public.
At least 5 senators are also willing to be vaccinated in public. Senate President Vicente Soto III says if citizens see their leaders taking the vaccines despite doubts on the vaccine's effectivity, then they will be encouraged to participate. Senate President Pro Tempore Ralph Recto and Senator Sherwin Gatchalian, Manny Pacquiao, and Bongo have also expressed willingness to be inoculated in public. Surveys show the government's vaccination program is still hounded by mistrust among Filipinos.
Handa po akong magpabakuna para ipakita sa mga kababayan natin na safe ito at kailangan natin ito. The benefits of being vaccinated against COVID-19 far outweigh the possible side effects na baka wala naman.
The Philippines will not lose millions of vaccine doses despite the delay in the arrival of supply from the World Health Organization's COVAX facility. That assurance coming from vaccine czar Carlito Galvez Jr. Pfizer vaccines from the COVAX facility were supposed to be delivered here in the country by mid-February. But Galvez says the arrival has been pushed back by a week as government iron out details of an indemnity agreement.
And now our lawyers are trying to finish it today, so that we don't have any more tinatawag nating obstruction on the delivery of the vaccine. Tinatawag nating delay. It's not coming from the Philippine government. We are only on the receiving end, and we are finishing our documentation on time.
Galvez adds the Philippines has yet to sign a supply agreement with any vaccine makers, since those deals should be dictated by suppliers and not the government.
The ball is not ours, not in our hands. Nasa kanila po kasi. Kung sabihin nila na we will pause a while, ganun po ang natin. Even though nasabihin natin na we meet, pero wala pa kung definitive nga po na date ng delivery. How can we have yung payment on terms?
Aside from Pfizer, the Philippines is also expecting to receive Sinovac shots this month.
The rollout of COVID-19 vaccines becomes even more urgent due to the presence of more contagious COVID-19 variants. Infectious diseases expert Dr. Ron Ginsolante says government must inoculate the majority of the population before any of the new mutations become the dominant variant in the country. He's concerned some vaccine brands have been found to be less effective against newer COVID-19 variants, particularly the one from South Africa.
It's still important that our government is really strictly implementing the testing for those who are coming from different countries. Quarantine procedures are in place. That's, I think, crucial to prevention of these new variants from really entering into our country. Until such time that most of the population will be given the vaccine, we still have to really implement this protocol.
The Philippines on Friday recorded 2,022 new COVID-19 cases, the highest daily tally so far this month. This brings the country's COVID-19 tally past 545,000, 33,000 of which are classified as active. The death toll nears 11,000.